I'm Julie Cashin, consultant with the Care Fund. Other days, I'm Director of Women's Economic Justice at the Century Foundation. And so happy to be with you all. I want to start by just flagging that we are going to hear a little bit from the fabulous Nicole Jorwick shortly, and I won't call on you right now. I see that you just took a bite, but talk about the work Caring Across Generations been doing, especially in California, but maybe a little bit beyond that too. And then we'll get to have a conversation and dig deeper into the financing of all these care policies. So first, just want to go around. You got to meet Indy earlier, so maybe we can start with Beth. Great to see you. Just name and organization.
Hello, Julie. You are on my list of people who I need to call. So this is a good flag. Beth Cantor with Omidyar Network.
Do you want to popcorn it to the next person?
Gabe, you're right on my screen.
Hi, everyone. Good to be with y'all. I'm Gabe Rose with the Heartland Foundation, and I'll pop it over to Jasmine.
Hi, Jasmine Laksamana, Archstone Foundation in California.
Great. Isha, you want to go next? We can try Marley if you're not available.
Hi everyone, Marley Williams, and I'm a program officer at the James Irvine Foundation here in California. And I'll popcorn to Jasmine.
Jasmine went, thanks. But Anthony, do you want to introduce yourself?
Sure. Hi, everyone. I'm the program assistant with the Ford Foundation on the Future of Workers team, and it's great to be with you all.
And Isha, are you available? All right, we're going to go right into Nicole, if you are ready. Okay, I was like, I can keep talking. Nicole's gonna share with us for a few minutes about her work, and then please be capturing your questions as she talks and we can have a conversation.
Thanks so much, Julie, for the invitation and for the introduction and for letting me get I got lunch in before 3, so that's a real victory today. But glad to be joining you all. My name is Nicole Jorwick. For folks that don't know me, I'm the Chief of Advocacy and Campaigns at Caring Across Generations. I have been there about 6 or 7 months and come from the arc of the United States, so more of the disability justice perspective, and am also a family caregiver myself. I have a brother that has autism who's about to turn 33 and is in the other room, and also on the care team for my grandma who has Parkinson's. So care is universal, and it's something that we all have in common, which is a preview to something you'll see coming out from us, the idea that care is something that we all have in common. Caring Across is really focused on bringing together family caregivers, paid caregivers, and those who receive care to make sure that they're represented in the policy. And we work in 3 different ways: around narrative and culture change, big policy change, and also through making sure that we are building a constituency. So we have a Care Fellow program, and actually very excitingly are just starting our Care Fellow program in California. It's our first state level cohort that we've ever done. And that's because of the work that we've been leading in California and working on continuing to build. And actually, it was interesting to hear Mark bring up the universal family care idea, because it's something that Caring Across Generations was part of considering, and we've been doing a lot of research around it. And it's also why I'm really excited. That research and also what has happened in the landscape is also part of why I'm excited to kind of talk about our shift away from that. It's not because the idea of universality isn't what we're going with, it's actually is what we're going with, but the idea that we're going to be able to create something that would work. As Mark said, the main payer for long-term services and supports is Medicaid. That is a federal and state partnership that's really complicated. So the fact that we could create something that would overlay with every Medicaid program and every county-based program, and also include childcare and paid leave, we really learned through our research. So we're getting ready. Actually, it's a good time to be having this conversation, because we will be releasing in California our update kind of off of the Universal Family Care paper that happened, I believe, in 2018, to kind of explain the shift that I'm about to explain. The paper will do a better job of it, but I'll do my best. And really, it is the fact that the research that we did, and to center folks that might not have been familiar with the work that we were doing, we were looking at a local benefit model pilot for this type of universal family care, something that would address the needs of paid leave, childcare, and long-term services and supports. We did that by doing a lot of research with great partners in Oakland, Los Angeles, and San Francisco to look at how that would really work, the costs associated. Between the costs associated with it and what has happened since 2018, obviously we've had a pandemic, and also we've had a great deal of federal and state investments, whether it was short-term or long-term, in some of these programs. So based on the data that we got about the high cost of even trying to do something small and local, and the fact that the advances that California has made, for example, Medi-Cal is working towards eliminating some of those restrictive financial eligibility requirements because of the federal money that has flowed in. They have their state wide plan on master plan on aging that also does have some correlation with the disability community. They're also working, we've been working really closely with our allies there on some of the paid leave bills that hopefully will be passing in California. So we're really a lot closer to a universal statewide model. And so what we're doing is shifting from the idea of this benefit model pilot that was localized to a statewide policy framework that can actually get us to universal long-term services and supports, paid family leave, paid family and medical leave, and childcare. And so we've started going off of the learnings that Caring Across Generations has had running the Care Can't Wait Coalition. That's something that a lot of people don't realize, but Caring Across Generations coordinates and leads that coalition. It's something I didn't necessarily know, even though I was part of the coalition when I was at the ARC. And so we use some of those the learnings there to make sure that we were really coming in and authentically learning from the groups that were already leading on the ground. And we did that through the process of, the research, we did a lot of interviews and on the ground work, because our focus is really on centering the needs of the BIPOC communities in California. And so because in a way, we're making this pivot that is going to lead to a bigger result, but also because we did that groundwork while we were doing the research, we became known in the state. And that was an important thing for us, to be conveners, but also to be amplifiers. And so I think that's that's kind of where we are now. We've built those relationships. So we have the Working Family Coalition that's really leading a lot of the paid leave work. We have Parent Voices in California, which is leading around a lot of the childcare pieces. And we also have the LTSS for All Coalition as part of our table, so that we can actually come up with this statewide set of policies. That's our ultimate goal, to have that out at the end of this year. I will stop talking now. I'm happy to answer any questions, but as I did reference at the beginning, we do have a big community facing paper and also a longer form paper that kind of explain this, lay out our research findings and the shift. But we're really, really excited about it. Obviously, with California being bigger than a lot of countries, when we get to success, it's going to show other states what's really possible. We're also doing work in a lot of other states, I would be remiss not to mention, and it's going to be different bites at the apple. But why we're most excited about California is because we are really because of all the advocacy that happened well before we were there, we're in a moment when we can really make a huge impact with what we're calling California Care Can't Wait.
Thanks, Nicole. I think, the work that y'all have done has just been so informative and powerful. And I'm going to take facilitator's privilege and ask a first question or sort of start with a comment, which is just, I have long really supported the concept of a universal and, a care collective from the perspective of organizing and communications and kind of building the case for care as a public good collectively, while also having a lot of concerns about the policy model and the financing model. So, and everything, including that childcare has been done very differently, has never been a social insurance model. We have no tests for that. We don't know what that looks like. And we do have other models that we can be building on for childcare. Not that they're great, but they are what we have in place. You know, and also that when you combine so many programs into one policy, you actually could shrink the whole thing in the end when we know how much investment is needed in all of them. And we've seen models like that happen in the UK when they've done things like that. And even when we used to fight against the super waiver in TANF. So would love to just hear, you know, any specific feedback on that, and would love other folks to weigh in as well.
Yeah, I mean, I think what you're hitting on is exactly the point. I mean, I remember when I was still at the ARC when this kind of idea came out, and I was like, yeah, it sounds good, but there are all these other systems that, yes, are not great, but that do exist. And it's, sorry if you hear my brother, but they do exist, and they have been in place. Actually with childcare and with home and community-based services and LTSS since 1965. And so how do we work on making them work and work better and work more equitably versus kind of doing a piecemeal approach, which is frankly why we got where we are in the first place, why we have this kind of Swiss cheese, and that might even be stronger than is the system that we have. And I think part of that is, anyway, I'll get into like how we get there, but I think that, and would love to hear what other folks think, especially since a lot of you are in the state. That would be, but you know, that kind of universal perspective, if that resonates with folks.
Do we jump in and ask questions?
Go for it. Indy and then Beth.
Well, first, thanks, Julie. I feel like almost anytime I do anything care related, you're actually secretly or not so secretly behind it. So thanks for including me and for your work on this. And Nicole, it's great to spend some more time with you and share some more space with you. And as you may know, in my last role at Georgetown, we worked closely together on the California analyses. One of the, in addition to the issues Julie raised, but one of the additional challenges that I think we are all thinking about is how far can we get with this is what's possible in a blue state model of like theory of change versus like, and here's what you can get in a purple state or something else like that. And I'm just curious how you're thinking about that on these issues. And you know, pre-K might be a bit different as if you want to include it as part of this conversation, since we've had Oklahoma, you know, and other more conservative places make very substantial investments in that area. But I think broadly for home and community-based services, certainly paid family medical leave, the correlation between state ideology and the quality of policies is almost linear.
Yeah. I mean, and also the fact of the matter is that it actually doesn't always, because I'm in my home state, which is Illinois, which has been historically very blue and has a 20,000 person waiting list for home and community-based services. So there's not always a correlation, but it's also true that you're not going to get the same thing. So just to be really specific, so obviously in California, because of all the things I already laid out, they're a lot closer to taking a step at making all of the three, what we call the pillars of care, universal, hopefully. And maybe not this year, definitely not this year. I say that tongue in cheek, but they're a lot closer to that end goal. There's also a lot of groundswell of support. We've been talking to Million Voter Project and also Michael Tubbs' group, Ending Poverty in California, doing some pop-ups, but that's California, which is its unique thing. We also are doing work in Illinois and Georgia. So I'll use those two as an example. We're not just doing work in Illinois because I'm from there. It was the one that made sense. But in some ways, Illinois, there's more support on the ground and some potential bills in the paid leave space and even in the childcare space. And so it might be that it's paid sick, or that it's and that it's some growth of the childcare programs. Obviously, our focus will be to do that in an equitable way and getting money to get 5,000 people off the waiting list. That might be what Illinois looks like. In Georgia, it might be even narrower. So that's exactly kind of our thinking too in the states that we're going into, is how can we use this as something that's transferable? Obviously, California will be a big win when we get there, but it's not going to be possible in other states. It might actually be possible in some of the other ones near there, maybe even in New York. But that's exactly, Indy, the thinking that we're starting with strategically, is how do we go in and make an impact no matter what the political makeup and also the backwardness of the different programs look like.
Thanks, Cindy and Nicole. Beth, you had unmuted.
Good, very observant moderator, Julie. I was going to dovetail off of your question, which is something I've really been wrestling with, is just how do we do this in a way, given that the complexity of the policy and the pay-fors and all of that. And do you, Nicole, like, and I've had lots of conversations with Daijin about this too, like, you know, is this actually something that we think that we can get done, or is this more of a narrative messaging push in terms of creating the conditions so when things are more amenable that we might be able to move? So just, I'm trying to, and I ask you that with my own, you know, trying to take off my Pollyanna hat that I typically wear as it pertains to these issues and putting on a more pragmatic one, just recognizing, like, can we actually get this done? Or is this, we're trying to soften the ground to be able to have these conversations so that we can move when the Overton window shifts, which I actually believe has shifted.
Yeah, I mean, I honestly do think that we can, and it's because the ground has shifted because of things that we couldn't have seen coming, right? I mean, I know in my decades plus of working specifically in the HCBS space, a lot, there was a lot
community-based services, just
sorry, thank you, community-based services. Things like nursing home lobbies were a reason why I thought maybe we would never, well, they've had their comeuppance because of everything that happened, the horrific things that happened. Not that it's anybody's fault, but it's a reality that happened. The thing that I've been saying, the reason that I really do, Beth, to your question, think that we are, is that I think that there's a societal awakening to the fact that these problems exist. There's also a better understanding in the LTSS space in general. A lot of people think Medicare is going to have them covered. Don't realize that Medicare doesn't cover long-term services supports. And I think that kind of genie is out of the bottle is kind of what I've been saying. And we'll have to work hard to maintain that momentum and make sure that folks continue to see themselves in this. But I think we're at a point because of the pandemic and also because of just systemic failures even before, that it's understood. I mean, even things like on the workforce side with childcare workers and direct care workers making such low wages, there's an understanding in a way that I've never seen. I have luck is a weird way to say it, but I have a second job where I work with a state as an independent reviewer on a settlement agreement they have. So I have this really unique view where I get to like fight for this stuff on the federal level and then see how it's actually playing out on the ground. And the way that states and chambers and others are coming together on some of this stuff, like a week ago, I had a meeting and they're 2 years and 3 months into the pandemic, and just the still urgency gives me hope, which sounds messed up, but it gives me hope that we really are. In a state like California, we're really close. And I also, from wearing my federal hat, I come from an organization, obviously Carrying Across is also a nonpartisan organization, but we had at the ARC, I would say, leaned conservative because of our membership. And I've been having a lot of conversations in the last few weeks with Republican members who also feel that and also see that the genie is out of the bottle. We see it with really bad proposals. They're suck. But the fact that they're even thinking about it shows that they see the appetite in their districts and in their states. So that's my thoughts on it. And not just because they have to work on it every day.
Gabe?
Beth, go ahead. You
Was just saying thank you.
I really appreciate this conversation. I'm coming at this sort of new to the care fund, so coming at this a little bit as like a more of a layperson than folks on this call. I think a lot of expertise from pushing hard on this issue for these issues for a long time. But I just, I'm really interested in the sort of like red state conservative aspect of this, which Nicole sounds like you all have a lot of experience with, just because like it's, as an issue, is something that has been discussed, something that's almost universally experienced, is just crying out for like some efforts to really break through the partisan divide and try to build bigger, really durable coalitions around the sort of policies that like really everyone needs. So I'm really intrigued by that, but I also just want to lift up and appreciate the work to try to create model states. I mean, I live in California, and we just had our second kid, and it's just like, now that I have kids, it's stunning to me that we have 8 weeks of paid paternity or maternity. Like before I had kids, I was like, oh, 8 weeks, that sounds like a lot. And I'm like, you realize how wildly insufficient that is. And to think, oh, we're in California, this is the best we can do. Like, how can we be pushing the rest of the country to do better when like our model is 8 weeks? I'm sure there's states that, again, I'm coming at this like you all have, know all the policies in all the states, but it's just, I think, and I've done like a lot more work in, say, like the voting rights space, and like, I think there's been awareness over the last year or two that like it's tougher to call out Georgia when New York has a lot of the same shitty policies, right? Like, so we need to create sort of North Star states where we have more immediate sort of political opportunities. And so I just want to lift up like, yes, to sort of the cross-partisan work, but also like really appreciate trying to turn places like California into real model states that look like what we actually want, not just 10% better than terrible.
Yeah, definitely. And to your point too, on the fact that the bipartisan nature, I mean, at Caring Across, we use the term caring majority, right? It doesn't matter what your background is or political beliefs are. This is something that impacts everybody, as long as we make sure folks see that. And we have to also make sure that politicians see the power of the caring majority, which is something that's really important too. And something that we're also thinking about is, care is this common issue. Care is something that everyone has in common, which I already kind of previewed. But we also have to be doing better with the language that we're using. It's something that we're going to be doing some piloting with what we are doing in California. But I can tell you, and I just said HCBS, and thank you, Julie, for saying home and community-based services. But for so long, all anybody talked about in Washington, D.C. was home care. And that's one part. It's because that's what people know. So it was understandable. But the seismic shift and the fact that like home and community-based services is still part of the conversation on reconciliation, I believe in no small part is because people were using the right language. And so we want to do some thinking and some projects with disability advocates, aging advocates, labor organizations, healthcare advocates, because it's not even just these issues either. It's how are we all using the same language so that we can build to bigger wins, and also speak to both sides of the aisle. That was the connection. There was one.
Thanks, Nicole. Jasmine, Isha, or Marley, do you want to get in here with any questions or observations?
Yeah, just to give you, thank you, Nicole, for sharing all the work that you're doing in California and with Caring Across Generations. I'm a little bit familiar with that, learning from Sade and some of your other colleagues. So thanks again for the reminder and just the overall picture. That's really great to hear. So a lot of the focus of my work has really been with aging communities. Working particularly on the master plan for aging. So I think that's something that we're, coming from the aging perspective is really trying to change that language too, because not that, it's wrong to focus on one's particular community or need, but I think really looking at the master plan and seeing how, and really changing the narrative that everybody has a caregiving need. Everybody is aging and currently is aging. And we're going through this spectrum of what's going to be good for people with disabilities is going to be good for everybody. What's going to be good for people who are aging is going to be good for everybody. What's going to be good for young families like myself. I have 3 kids and it still hasn't changed as for each child, you only have 6 to 8 weeks, depending on how you gave birth. Or how you're going to be able to care for that person. So yeah, I definitely see the need and how we need to continually make sure that we're using the same language, because that language really has power in how we advocate and implement policy. So I don't know if I have any real questions, but more so, thanks for what you're doing. I look for ways that we can partner together and work together. Some of the work that we're working on is working with the Family Caregiving Coalition for California, and that's really focused on the needs of caregivers of older adults. But I'd love to see ways that we can intersect some of that work.
Yeah.
Since they're really working off of a template of like task force recommendations to the California legislature. But I really see that those are ways that, again, are going to be good for young families who have caregiving needs, all the way to people with serious illness.
Yeah, we would love to see if they have any interest in participating in our steering committee table or anything. So yeah, that'd be great to connect. I'll put my email address in the chat.
Yeah, I think their first meeting was last week, and then I think one of your colleagues from LA.
Oh, Malcolm probably
Yes.
was there. Malcolm.
Yeah. Malcolm, yeah, Malcolm was in that meeting. So
And if he's already, I can't keep track of what he's doing because he's doing too many things. So
he's doing a ton of stuff. Yeah.
Then you don't need my email address. Great.
Okay, so then we're good.
No, that's great. That's great to hear. And the what you're bringing up about disability and aging, and Mark sort of brought this up a little bit in his remarks, but it's something that I've spent a lot of my time in DC really focused on. I co-lead, we have a disability and aging collaborative that includes everyone from AARP and SEIU and Caring Across and the ARC. And because it's part of what the whole concept of Care Can't Wait and California Care Can't Wait is that we have to break out of the scarcity model or mode to actually get to the big wins that we need to get. And aging advocates, I know, because I started at the state level in policy, like aging advocates fighting disability advocates for the same dollars. It's like something's wrong here. And so that's what we need to break out of, because you're right. If we solve a problem for a person with disability or an aging adult, it's better for everybody.
I just want to build on that, just to note that like part of that is why the financing is so important, right? Because if we can grow the pot, if we can have a lot of money for these, which to Marika's point earlier, we can afford to do it. We just have to have the political will. Then we can be thinking about it in that bigger picture model. And there is going to be a tension always between sort of the fact that we need a home and community-based services system for aging and people with disability, for aging adults and people with disabilities, and children with disabilities. And we need a childcare and early education system, to Marika's point also, that includes a variety of different needs and interests. But the more we can come together to say we all need these things, right? And to use some common language and to all be fighting for more for all of us, I think that's where some of the power lies, as we've seen with Care Can't Wait.
Exactly. I was gonna say, I remember, Julie, was sitting in a Zoom with you in like August of 2020 when we started saying that, like, if childcare advocates can start speaking HCBS language and vice versa, like, and that's what we've seen. Yeah, it's amazing.
Isha or Marley, do you want to get in? No pressure.
I think a lot of my reflections have actually been covered by other folks in the breakout group, and apologies for joining a little bit late. I got carried away with making tea. But I think it's just really inspiring to see that sort of cross movement building and all of the ways that it has grown. And I know that that's something that we're really committed to funding and keeping the pressure on. And then I think the financing model, or the panel discussion of it, has really sort of helped me think about that piece of implementation, right? Because at the end of the day, financing is sort of one piece of implementing policy, and then enforcement is sort of like a separate category. But I think both of those are so important, and I know funders don't normally pay attention to that, or will fund just for the win and then leave. And you know, to fellow funders, I really want to encourage us to support organizations through that whole spectrum and not just the passage of the shiny policy. And I think that the financing discussion, which I'm very new to, really just hit that point home for me as well.
Thank you.
Yeah, and you all probably saw what I put into the chat, but it's something that the kind of payroll tax and other pieces, it's implemental progress, which is great, but we really do have to think from the beginning when we're choosing how to fund these transformative policies, that we can definitely inadvertently leave people out. And that's what, even with the Washington State model that Carrying Across worked on, that was when I was still at the ARC. When I was at the ARC, we had problems with it because it leaves folks out. And because if you haven't worked enough work orders, then you're not in. And while I'm a huge advocate for expanding employment for people with disabilities and employment for family caregivers, because there's a robust care system, it also can leave people out. And so we have to really be, which is why I think the narrative change component is so important, because I think we're talking about something that has probably never been done before if we're really going to do it right.
I'll just add one other piece to it, which is, you know, one of the most amazing things I've seen in the last number of years has been the coming together of the workers with the consumers of care, and the family caregivers, right? So when you're able to bring all of those components together, or all those interests, all those groups together, you're having a robust conversation. And I know in the childcare space, we've gotten to the point where you can't have a conversation with Moms Rising where they're just advocating for the needs of moms, because they understand that paying childcare early educators better actually helps moms too, because it means that they're going to have better quality care, and it means that their kid is not going to lose their teacher halfway through the year to Starbucks because they can't afford to keep being there. So I think there's been a lot of power in that, because everybody's started to understand how their piece of it matters for the other as well.
Mm-hmm. Yeah, I definitely think that's right. And as I have spent like the last 2 years trying to be at the center of aging, disability, and labor when it comes to HCBS, which is a real hot spot to be in, let me tell you. But it meant the most to me when one of the SVPs of SEAU came up and was like, thank you, because everybody has skin in the game and everybody's role is important, but there hasn't always been fairness, I'll say, in whose voice was leading. And so I think the fact that we are all working together makes the collective more stronger, not more strong.
We have 2 minutes left. Any final reflections? Anyone? No pressure, Nicole.
Well, I would be remiss to not thank folks. I know that there are folks on the call that already support us, and we really appreciate that. I just think that we're in for a fight, to Beth's point, to keep the momentum going. And so, you know, we're really excited that the Care Fund exists for that exact reason, and appreciate you all being part of it, because it's going to be incredibly important that yes, we're sharing stories, but we're getting past just sharing stories, that we're moving towards powerful change. That's what our goal is with our Care Fellowship program is, yes, share your story, but also know what's broken so that it doesn't take me or Julie or someone else to come in behind with what needs to happen, so that you're empowered with that as a constituent and as an organizer. And that's something that I think is really unique about this. Came up in the earlier conversation. I meant to bring it up here, that yes, it's all about grassroots advocates and organizers, but something that we've seen at Care Can't Wait National that we're trying to replicate in all the state work that we do is having a space where you have the policy wonks and the organizers in the same room, because that also hadn't really happened. And so, which frankly is part of why we got into the place that we're in now. So we're hoping to continue that to move forward, but happy to have anyone else talk. I'm done now.
I agree, Nicole. That can be absolutely where the magic happens when, if you're going to talk about centering the needs of the most impacted people, you have to help actually give some tools so that it's not just about the story, but it actually, you can I've sometimes called myself a policy translator, right? Like I can help translate between
Let's
your
steal that. I like that.
what's, what we can actually change or what we can do. And I think being committed to that, to not just being like, oh, I know because I went to grad school, right? That it's much more about like, oh, I know, and I can help you know too, so that when you advocate, you're, even more powerful. So
we're going to start just with introducing ourselves. And Yasmin, I see you have started recording. Thank you. Just very brief introduction of your name, your organization, and your pronouns. And then we will get into a few presentations and then discussion. As I said earlier, my name is Anna Wadia. I am the Executive Director of the Care Fund, and my pronouns are she, her, hers. And I will just turn it over to Miles, who's next to me on my screen.
Hey y'all, happy day to you. I don't know what time it is for everybody, but Miles Tokeno, he, him with Ole here in Albuquerque, New Mexico. And I'm not gonna choose anybody. Popcorn. Who wants to go?
Hmm.
Hi everyone, I'm Christina Bowen, and I'm an independent consultant, so work with a lot of different organizations, but I think we just met last month on the Grant Makers and Aging webinar because I'm helping Grant Makers and Aging with their caregiving community. So I'm really glad to be here and hear this. This is an awesome call so far. And my pronouns are she and her. I guess I can pick Grace. I don't know. You're the next person.
Hi, thanks for picking me. I'd be happy to go. I'm Grace Morton. I'm with the John A. Hartford Foundation. My pronouns are she, her, and I'm a graduate intern, and so I'm just learning alongside them in their work with aging populations this summer. Thanks so much. And then I'll go to Yasmin.
Hi everyone, my name is Yasmin Yones. I'm she, her. I am a consultant with the Care Fund supporting all their great work, and I'm also a movement chaplain based in DC. I'll hand over to Benjamin.
Hi, I forgot to shorten my name on my Zoom there to Ben. I'm Ben Vecti, he, him. I'm director of the Walk Cares Fund in Washington State, and I really appreciate all the work of the Care Fund. So excited about this project, and I learned a lot today already on the webinar, so thank you.
Let's see, Cameron, would you like to introduce yourself?
Sure, thank you. Cameron Clark, I'm a program officer at the Bezos Family Foundation here in Seattle, Washington, and he, him pronouns, and this has been great content. I'm excited to be here. And I will pass it to, who hasn't gone yet, sorry.
Marika, I don't think has gone yet, though of course she spoke, but you can introduce yourself to the group again.
Marika Cox Mitchell, Senior Director for Early Childhood at the Bainham Family Foundation in the Washington, D.C. area. My pronouns are she and her. Great to be here.
Thank you. Well, thank you so much. So we're going to start. We actually are very lucky in this group to have two leaders from two different states, from New Mexico and Washington State, who will share with us today. I think I will start with Miles from Ole in New Mexico. And Miles, could you spend a few minutes telling us about, so when it comes to financing, what you're doing is really fascinating because I don't know what precedents there are in other states, but New Mexico is about to have a ballot campaign to tap into the land grant permanent fund from oil and gas to fund early childhood education for the long run, right? So Miles, could you say a little bit about that campaign and what you're learning about how you build a base for such an innovative financing mechanism for care?
Yeah, thank you so much, Anna. So yeah, Ole has been working in the field of early education and specifically this campaign for funding for early education. for 12 years. This is a 12-year campaign for us right now, and we have finally come to the point where it is on the ballot after years and years of working through the legislative process and not getting anywhere because of, you know, Dems that were not interested in tapping this fund for anything other than continuing to line the pockets of Wall Street, folks on Wall Street, right? Yeah, so how it works is on the ballot is a question to tap the fund that is currently used and can only be used for education. Right now, we use 5% of that fund from oil and gas revenues for all of our public education. And what we're asking for is 1.25% more. So 6.25% of the fund to go to education, and 60% of that will go to early education, and the other remaining will go to continue to go to early ed. And in real terms, that means 150 million for early ed every year. And so this is a sustainable form that comes from this $26 billion land grant permanent school fund. How we have built a base around this campaign has been through speaking to those who are directly affected first and foremost, and organizing them to do a lot of relational organizing, speaking. So that means early educators who are continue to make wages that are not professional wages, as well as parents of folks who are in early ed who can't afford to pay. And who have also seen drastic changes in the ways that they have been able to access early ed, and want sustainable and permanent changes to be able to continue to afford access to early ed. So that is who we have focused on, and who we focus on as the messengers for this work. One of the ways that we have talked about funding with folks who are not directly affected, that has been extremely helpful, is talking about the funds as the public's funds already, right? These are the funds that corporations have to give back for using the land, for using our labor, and that has been extremely helpful, as opposed to kind of thinking around the ways in which people can feel scared about money in a place that we have been 50th or 49th in child well-being for decades, and so any more spending oftentimes comes from a scarcity mindset, and so it is a worry. But when we hear that, number one, it's not going to raise taxes, and number two, this is already the money that we should have access to, but instead is going to more investments on Wall Street and being invested outside of our state, that changes people's minds and hearts in a lot of ways, because it does feel really nervous, and scary to talk about that kind of funding. And so, did I answer the question? Yeah,
definitely. Thank you. Why don't we just give folks a chance to ask you, Miles, clarifying questions before we move on to Ben, and then we can dig into deeper conversation. Any clarifying questions for Miles? I actually have one, which is, you mentioned early ed, Miles. So is it pre-K, or is it childcare and pre-K? What are the age groups that will benefit from this?
Yeah, so the exciting, I'm thinking about what SJ said around looking to things that that has worked in the past, but also being innovative in approaches. And one of the things that I think is really innovative and exciting about this approach as a constitutional amendment is it enshrines the right to education from birth. So that is childcare, as well as, yeah, it is everything, including even home visiting. And so we're really, really excited for, this expansive possibility, and opportunity.
This is a constitutional amendment on the ballot? Is that what it is?
Yeah, Ben, exactly.
Okay.
That New Mexicans will vote on in November. And
So
obviously
exciting.
sticking with values and family values is the most important thing, right? Around the fact that we, as a community, take care of each other, take care of ourselves, take care of our family members. And I think this is an extension of that.
So it's
exciting. Well, in
universal,
truth,
like
yes,
everybody's,
Christina, go on.
yeah, sorry, I was just following up on that. So it's totally universal, like everybody born in New Mexico would get it.
Yeah. And so, so exactly. Yeah. So this is a universal approach. In previous iterations of the legislation, that to put it on the ballot, we included some enabling legislation in there to try to get in there around equity. So being able to state that this, that the funds are going to two different places. One is extending access, two is to expand teacher wages, right? For the most part, teachers in New Mexico are still making less than $15 an hour. We want to boost that up to $18 an hour as a starting wage. And we have been working with a group of early educators on creating a wage and career lattice. So having multiple forms of recognizing education, experience, etc. Bilingualidad. Okay, that was Spanish. Whoops. Or that was it. Yeah, bilingualidad. I'll use that. To continue to create a lattice, right, and a career ladder. And then for the universality, we really wanted to focus and kind of focusing on having the equity lens. We want to focus on the funds first going to places that need it, that going to centers that are BIPOC, women-owned, not corporate, local, etc. And so that's the way that we are going to be pushing the enabling legislation, if and when this passes.
Right, Marika, did you have a question for Miles?
Yeah, Miles. So I know New Mexico is currently using some federal dollars to offer childcare to most. There's still an income eligibility, but the ceiling is pretty high compared to others. Do you think that backdrop helps pave the way for this initiative to be successful?
Exactly. Yeah. So right now we have with a combination of help from having a great governor, a Democratic governor, Michelle Lujan Grisham, and the creation of the early education and care department. And we've worked really closely with the secretary and Secretary Gerginski to expand accessibility through those federal funds. Right now we're at 400% federal. If you're below 400% of the federal poverty line, early education is free. Childcare is free.
Incredible.
Yeah,
That's
and
great.
so That actually came from a legal strategy from a few years ago when we sued the previous Republican governor.
Well, and
That
I
extended.
know that your governor also used to be the state Union on Aging director, so that's kind of a cool fact too.
Huh.
Yes, indeed. Yes,
Wow.
indeed.
Yeah.
Wow, that's a great transition, Cameron. We will come back to your question, but I want to make sure that Ben can join in. And in true Care Fund fashion, we're going to move from early childhood education and care to long-term services and supports and long-term care. So Ben, you this is an issue that you have been a scholar in and an advocate in nationally for many years, and then you went to lead one of the first programs in the nation in Washington State. So can you please share some of the lessons that you've learned, especially as relates to how the Washington Cares Fund is financed and structured?
Sure, happy to, and thank you so much for having me today. And I was really interested, Miles, to hear about what you're doing in New Mexico. That sounds like a tremendous advance and innovation. It's exciting. I think one of the things that strikes me thinking about though is that like in Washington State, we're far less. We're a much wider state than a lot of other states. I mean, and we're less urban than a lot of places in the country. We're a divided state politically. Eastern and Western Washington. I spend a lot of time, probably 3 times a week. I do meetings in community groups, and we've done quantitative and qualitative, we've focus groups, qualitative focus groups. We've done quantitative surveys and stuff like that to understand how Washingtons view the program, to work on our outreach strategy. With the holding company, Anna, you'll remember them probably from some of the work we've done in the past. I know you've worked with them as well. And there are a lot of middle-class people in rural areas and small towns in Washington State who are always have an eagle's eye out to see, is a public policy serving people in Seattle versus people in Spokane? And there's that dividing line that's very strong here. I think it's different. Hearing everyone talk in the webinar today, I think the East Coast and California and New Mexico probably have a different political culture than we have in Washington. I know Washington has a reputation for being progressive, but that's really only the Western corridor from like Seattle to Olympia. And so my work in the past, but to me, I think you need a collective identity to mobilize people. That's true of mobilizing, that's true of organizing, it's true of generating revenue, sustainable revenue sources to get people to be willing to have a redistributive social policy. You need some we group. I think the core of it, you need a we group that people feel part of. In order to say, I'm willing to share. In political science literature on social policy and international empirical data research on social policy, generous redistributive social policy only happens when people see the collective identity group as an extension of their family. They see, I don't want my sister to sleep under a bridge. So that's the origin of this kind of collective identity, people in families. And then I don't want, if you can get them to think, I don't want people in my guild. In the medieval period, it was the guilds. That's actually the origins of social insurance. The 1300s were the guilds, where people in the same trade had a collective identity as table makers or whatever in Belgium or Germany or France. And they didn't want people in their guild to suffer. So they all were willing to pay into a fund that insured them all against, for health insurance, pensions, workers' comp. All of that existed in the 1300s. It was nationalized in the late 19th century and became national social policy, what we call social insurance today. But originally it was guilds or worker self-help funds. All of that is predicated on collective identity, right? And so I think a lot of work has to go into that, building that collective identity. Now, ironically, the only reason our program was enacted in Washington State was because workers had power. SEIU had power, and they were able to push it through, right? So that's the first step. It's essential. I think you need worker power to get the wage component, which is so important. If you don't have worker power, you're not going to get that part of it. You might get the social policy, but you won't get the wages. So you definitely need the head of the spear being worker power, and you need to invest in that. But that's not sustainable as a social policy. That gets you enacted. It doesn't get you 10 years, 20 years, 30 years. And so the fact that SEIU had to push so hard to get it enacted leads a lot of people, when I talk to people, even progressives in Seattle, a lot of them will say, well, you know, of course, walk cares, of course the unions want walk cares because they benefit from it, right? And so that kind of undermines the collective identity argument, right? Which is we're all in it together. And so you have to have a delicate dance between having strong worker movement, but then using a narrative, using a collective identity story around care stories, around families, around, you know, quality jobs means quality care. And ultimately it's about, we're all in this together. And I think social insurance offers you a chassis to do that because it's based on this collective identity. So I think you have to, I agree you have to be flexible and so forth, but I think social insurance is a powerful chassis to do that. Another thing to keep in mind is that once you get a program enacted, like a social insurance program, for example, it's not perfect, covers about 92% of people initially, which is better than the 0% we had covered before, right? It's not 100 though. I think a lot of times we make the perfect the enemy of the good. But like we have a team here at Washington State, like we're working every day to get from 92 to 100, right? And we have a program in place and we can do that now. We can work on that every day. If we didn't have the program in place, we couldn't do that. we'd be stuck in annual appropriations battles, struggling for crumbs every year and lose. And whenever the other side was in power, we would lose whatever we'd gained, right? But now we have a program in place. Now, if the other side wants to cut our program, it's really hard. Social insurance is hard to cut. So what are they going to do? Cut the benefits? Well, if you want to cut the benefits, you're going to upset everyone in the state, right? It's not popular to cut benefits. Well, what if you cut the payroll tax, the premium? If you cut the premium, that means we're not funded through 2080, we're funded through 2060 or 2070. It doesn't hurt us. It doesn't reduce my ability to implement the program. So what are they going to cut? So there really is nothing so it's hard for the other side to chip away at a program, a social insurance program, once it's in place, because you have a 75-year funding horizon and we have a dedicated revenue source they either have to get rid of the program entirely or they really can't hurt us very much. So it's a useful tool, both as an organizing tool and as a tool for sustainable maintenance of the program, but it doesn't survive on its own. You have to have worker power as well, or else what you'll end up with is a program that works really good for old white people at the expense of women of color who provide the care. So you have to have both, and you have to tell a story that includes both the workers and the beneficiaries. That's my take on it. One last thought, if I could, on it. We have to keep in mind that we're not designing a policy paper here that we're going to put online and be really happy with our policy paper, right? We're trying to design a program that gets enacted, that actually helps people in their lives. And it's much harder to get 51% of people in the state to support a program than it is to design a policy paper that's perfect on paper, right? And so I think we have to be willing to make compromises at the start to get something enacted and then try to build it out over time. Get your foot in the door with a structure or a chassis that's capable of being expanded. Like Social Security was terrible at the start, excluded domestic workers, excluded agricultural workers, which are all predominantly people of color. But over time, 10 years later, they were all covered. Then people with disabilities were covered, then spouses, then surviving family members and so forth. And over time, Social Security became much better. And I think we've already seen that with walk care. So that's another thing I think is to not try to get the perfect policy at the start that may not be enactable, but get something that you can get enacted and then has a good structure for building it out.
That's really, really interesting. Good point. So does anybody have clarifying questions for Ben?
I was curious, like, what were some of the messages that resonated with the eastern part of the state? Like, what were some of the things that they brought to the collective identity table?
Well, to reach them, we have to talk about care stories. The care stories resonate with everyone. It gets them. So one thing that I'm seeing in all the, I do 200 of these a year probably, and what you notice over and over is that people, especially today, are in this like turtles pulling their head into a shell. People, because of the pandemic and the economy's unstable and globalization, people are scared and panicked, and they're receding into their own individual space, and they don't want to share. They have cameras outside their home. They have guns. People are scared of the world, and they're not in a mood. They're not in a space where they're able to have a collective solution. And you got to get them to get out of that headspace and into a headspace of families and human beings and kind of a humanistic space. So we try to tell care stories. And once they start talking about, like the icebreaker today, I wrote it down. I'm going to use that the next time I do one of these, like getting people to think about people and their families, who they care for. Then they start, and then suddenly they think they're not being intellectualized. They're not intellectualizing about this. They're not using talking points. They're thinking about, how can I solve the problem that my mom has or that I have or whatever.
Right. You know, Miles, I'd love to bring you back into this conversation, because I think what we're realizing here, looking at the chat, is that there's probably more similarities than we would have thought between New Mexico and Washington with the rural-urban divide. And I would guess also with the strategies of using stories. I know that is something Olay does all the time. So could you share a little bit of any observations you have reacting to what Ben has said?
Yeah, of course. I think, yeah, Ben, what is kind of up for me is around, yeah, the sharing of the care stories from both perspectives, right? And being able to do that, right, allows us in a lot of ways to get deeper into these shared values that we have, that that oftentimes chambers of commerce as our as our opposition are good at you know, yeah, so often they're able to do the, like, what is it, death by 1,000 pricks, right? And kind of like and continuing to get into the storytelling that is around those base and foundational values. I think also speaks a little bit to what Marika was talking about around the mental shifts as well. And so, yeah, I see those connections. And especially when we're talking about, oh no, we don't want to listen to the people, you know, in the big city because it's so very different, and y'all are so progressive over there, and you don't know what it's like, you know, etc. When we're trying to raise a minimum wage or anything, you know, or trying to pass paid family medical leave.
Yeah, I mean, if I could respond, I think, Anna, this reminds me, and Miles, of, like, you know, the carrying across work with Ajahn Poo, and that there's no shortcut for the work that Miles is doing around relational organizing, and there's no you can't shortcut that. I feel like I need another, like, you know, 100 organizers to go around the state talking to people. Like, we need our program got enacted in many ways before we had the chance to do that kind of organizing in the state. We had a union that was able to get the program enacted in the capital, or not in the capital, but in Seattle mainly, but in Olympia. But we don't have the whole state behind us yet. And turning care from a private responsibility to a public responsibility, where we have to solve this problem together, I think we have to get people there through organizing. And if we don't do that, programs won't be enacted and they won't be sustainable. And I think that's where we need to invest in the medium term in order to lay the groundwork for policies to get people to support 51% of people in the states to support these kinds of policies.
That's great. That's great. Cameron, you had a question earlier. Was that question answered in the chat, or did you want to share it?
Miles answered it. Yeah. No, thank you.
Great. Anything else? Any other questions or observations you have?
No, I mean, I'm obviously having some of the lenses of a Washington State resident as I hear Ben talk through these issues, and this sort of dichotomy here, both with the urban, all the things we've talked about, but also, our general tax structure is so progressive here, and so we talk about some of these really progressive things that are happening, but we actually don't have an income tax. We were able to do some things. I just think it's interesting to move on some things, but then not have a really fundamentally fair tax structure that sort of undergirds it. But I'd love to hear Ben talk more about that, but probably it's a slightly different subject. So, yeah.
And Marika, you had gone off mute for a second. Did you have a question or a comment?
Yeah, I mean, Ben, I'd like to you to unpack the perfect yet enactable. Like, how do you get people away from perfect is the enemy of the good? Yeah.
I've studied internationally social policy in these areas, and the only place that has tax-funded universal generous social policy is Scandinavia. But the rest of the world, and they have your own political culture that's different from ours, but Germany, the Netherlands, Japan, Korea, the rest of Asia and Europe all do generous social policy through social insurance, but they build it out in such a way that it's essentially universal. Like in the Netherlands, in their long-term care program, as soon as you start paying in, you're covered. You don't have to vest or anything. And if you're not covered, there's backstop programs for you. But political culture is a real thing, even though we can't see, smell, or taste it. It is there. And if you don't try to marshal it and work with it and leverage it, you're going to fail, in my view. That's my personal view. And that we have to spend more time trying to understand, how do people think about their relationship to others in their society, and how do we, in the relationship of public and private sphere, how can we try to move that discourse? But then we have to work with it. We can't just design a policy on paper and then fight for it in the Capitol. That doesn't work. Like, you have to bring people along, and you have to meet them where they are, and then bring them to where you're trying to go. And I think there's a tendency in the think tank world to just try to write a policy paper, have a conference, and design the perfect policy and think you've won something, and you haven't won anything. You have to actually bring people along with you, which is why I think it's so important what the Care Fund is doing, investing in organizing too, and storytelling and all of that to bring people and culture change. I think all that is really essential.
Right.
Yeah. And
Grace, is there anything? Oh, go on, Marika.
No, Miles.
I was just gonna hop in there and like think. Yeah, I'm thinking about all. So yeah, I'm thinking about another piece that of our work, which is in our workers' rights realm. We have a lot of interest in GBI, and there's a lot of interest in GBI, and there is such little interest. Or it polls so poorly in New Mexico. Right, it's like no, we got to work for what we get or whatever. And so thinking about what you asked earlier, Marika, around how does these little experiments or these little expansions from other forms help guide the other work, right? So like the 400%, the federal funds for expanding childcare access. And I think that's exactly what it does, right? Is you get to be able to then take those stories, expand it out to be able to show how much it works and how important it is, and be able to kind of broadcast it so it doesn't seem like we're Venezuela or something, or whatever people are afraid of,
well, I think for childcare, right? For childcare, it's absurd to talk about earned benefits, right? Because children, I mean, I want my 3-year-old to earn his stuff, but he's probably not going to earn much at 3 years old, right? It's just an absurd. You can't talk about earned benefits for children, right? And even parents are often in their early 20s. I mean, you don't have any money at that age, and so I think childcare is a totally different debate from like long-term care, for example. Or even paid leave, but unless you do it all through universal family care, which is a way to, tie it all together.
Yeah, I think we're seeing some of that continuity work in DC as well. In many ways, this compensation win for early childhood educators goes all the way back to the 60s, right? If you just keep adding to the story, right? Getting to your percentage, getting to the 96 and then just adding on seems to work best. And just having that continuous story as well as the advocacy. I mean, DC is relatively small compared to New Mexico or Washington, but I think that level of continuity, I mean, even our current policy table still have those elders at the table playing a different role, but yeah, that continuity.
One thing I would add to build on that is that I've seen once you've got a guaranteed benefit in place, whether it's through social insurance or through a guaranteed other way of guaranteeing something, then I've seen this in many different contexts. In Germany, for example, right now with our long-term care system, I see it. Once you've got a guaranteed benefit in place, then you can start talking about, well, we have a shortage of workers. We have a shortage of teachers. We have a shortage of care workers. And then, because that shortage is defined relative to the guaranteed benefit that people are expecting and the quality of that benefit. And then that creates a space for talking about worker wages in order to bring people into the space. So that's another organizing or discursive strategy, I think.
Hi, everyone. My name is Pooja Devin. I'm a consultant to the Care Fund, and I'll be lightly facilitating our time together. Excited to see everyone. What we're going to do in the next about 30-35 minutes together in this small group. And what we're going to do is we'll quickly just go around and introduce ourselves to each other, say our names and our organizations. And then we have Ashley Pinelli here with us. She's from 9 to 5 and worked on the paid leave campaign in Colorado. So we'll hear from her for about 5 to 6 minutes on that campaign and her lessons learned. And then we'll have the remainder of our time to just have a group discussion. Obviously, lots of good questions have already come out, lots of energy to dig in. So hopefully we'll have plenty of time for that together. And obviously both Mark and Sade are here as well, who can also answer questions and help guide our conversation. So if that makes sense, we can jump in. I'll let people introduce themselves. Again, I'm Pooja from the Care Fund, and I'll pass to Sade on my left, and then Sade, you can just popcorn to the next person.
Good morning, Sade, she, hers, family values at work. I will popcorn to Ashley next to me.
Hi, everyone. Ashley Pinelli, she, her pronouns with 9 to 5 Action Fund, and I will pass it to Kiara.
Thank you. I'm Kiara Nagel, she, her pronouns, and I work as a consultant, independent consultant, and I've been doing some work with the Care Fund around strategy. And I will pass it to Sophia.
Hi, everyone. I'm Sophia. I'm an intern with the John A. Hartford Foundation. Happy to be here. And I will pass it on to Adeline.
We've got a group of us here. I'm Adeline Azrak. I use she, her pronouns, and I'm with Fondation Chanel. I'll popcorn it to my colleague.
Hi, everyone. Raymond Peel, work with Adeline and Benedict over here at the US team of Fondation Chanel. I use all pronouns except it.
Hello, everybody. My name is Benedict Borestin. I use she and her pronouns, and I work here at the Chanel Foundation with Adeline and Ryan.
Shall we pop it to September?
Hi, I'm September Jarrett. I use she, her pronouns. I work with Heising Simons Foundation. We focus in birth to 8 early care and education, and particularly interested in the financing conversation. And joined today, we're a Care Fund supporter, but I hold some work trying to do intersectional work in California. So I'm listening for lessons to bring to my home state here. And I will pass it. Do I say it Filene?
It's Feline. Hi, everybody. I'm Feline Wiggins. I work with SenCal Health. I use she, her pronouns, and I've led caregiving efforts across several counties here in California. So great to be here.
I think everyone heard from Mark, but Mark, if you want to say hi and bring your voice to the room.
Yes, and you know, it's funny, Feline and I are good friends. We had our 2 minutes together at the beginning of the session. So
yes.
I'm very happy to be here, and I'm at the Leading Age LTSS Center. I'm a co-director and then the research director over at Community Catalyst. So very happy to be here, part of the conversation.
Great. Thank you, everyone. Thanks for being here with us. Ash, I'll turn it to you to hear more about the campaign and to walk us through your lessons learned.
Hi, everyone. I didn't realize that I was like the only person in this breakout doing my lessons learned, so I'll try to make it juicy. But again, I'm Ashley Pinelli. I'm the political director at 9 to 5 Action Fund. We're a new C4 organization, and prior to my role here, I was with 9 to 5 Colorado, which is a women's economic justice organization. And I led our paid family and medical leave coalition, and we actually were the first state in the country to win a paid family and medical leave program at the ballot. So we tried at the legislature, moved to the ballot. So I do have a lot of lessons learned from both sides, but we're talking about financing today. And a lot of my lessons learned were already said by Mark and others in the first part of this, so I won't repeat too much of that. But just some things that I wanted to highlight in addition is that, in Colorado, we did choose to run our paid leave program as a social insurance model because we just do know that that is the most equitable way to provide benefits to all communities, especially folks who really need access to paid leave the most. Because again, like the risk assessment on social insurance models is strictly based on utilization and not other factors like gender and age and race and these other things that can like drive up costs that we see in some of these other private models. I think that another really important reason that we did choose to run the program as a social insurance model, and I think I'm not sure I heard this in the presentation, but I think this is so important, is that regardless of your funding structure, a huge piece of equity is ensuring that your program is portable, that the program is not attached to a job, that it is attached to the worker. This really has huge implications for like a worker's autonomy in the workplace, to make sure that they're not beholden to a job for benefits, and that they're not thinking about their employment as a condition as to whether they can take care of themselves or their families or have a baby, that the benefit follows the worker around. And I think that when we're thinking about funding any structures, we should really be considering the pieces of equity, like what makes a social insurance model equitable. I would say that another lesson that I've seen, especially coming out of the pandemic, is that this structure really allows a lot of flexibility for workers and employers, because the state's only incentive to administer a program like this is to administer it like well and effectively. There is no real profit incentive that is like antithetical to providing benefits, where you're just trying to administer these benefits. And when different situations arise, it allows the state and lawmakers to be really flexible when it is housed by the state. An example is that states that already had paid family and medical leave programs in place at the start of the pandemic were immediately able to expand their benefits as a response to the pandemic, because they have the jurisdiction over how these programs run. It wouldn't be so easy to do that if your Aflac or your Pinnacle were the one, like a national corporation, were the one administering the benefits in your state. And I think, from an organizing standpoint, the funding model is really, like a social insurance funding model is really popular amongst workers and voters. And it's a relatively easy sell. It's easy to mobilize a base around something because it simply is the most equitable and economic model. And when you're presenting the thing that is factually economical, factually equitable, it's an easy sell. People understand that really easily. And people are getting the gist that like private insurance companies aren't all that helpful. They're really not inspired by policies that are just excessively bureaucratic with little return. And no one wants, you're not going to have 200 people show up to a rally to say, why don't we start a program in a decade from now where you're going to have to fill out 30 forms and then your claim's going to be denied. And then you have to try to interpret all this legal jargon, and then maybe you'll get a check cut in 6 months, right? Like these things actually resonate with like the average person who is utilizing these benefits, which is why we were able to secure a pretty solid win on the ballot with a very secure margin. And I would say that some issues I've seen is that this model isn't always popular with like our opposition or business friendly folks. And, we had a huge fight in Colorado about the funding structure, whether it would be a social insurance model or a private insurance model. And we actually ended up, the coalition pushing this program. Once there was the threat of turning it into a private insurance model, we actually switched our position and opposed that and took it out of the legislative hands and brought it to the ballot. So I think that there's definitely some work to do around like the narrative about how to best fund these programs, because alternative models to fund paid family and medical leave can be like really detrimental actually, and cause like huge inequities. So just a couple other points. I think another very real issue that we're encountering is that while we are supporting public goods and a social insurance model, our state departments, the reality is that they are systematically underfunded and under-resourced. And it does create a lot of obstacles for them to administer the program. And then it creates this sort of cycle of a narrative that you can't get out of, that your government is inefficient, it can't administer these programs well, so we're going to continue to gut these state departments so that they prove to continuously be ineffective. So I think that that's not a reality to shy away from and to try to take like these power away from our state departments. But I think we really need to be looking about like the interconnectedness of all the issues that our states are facing and look at the barriers of financing these types of policies holistically. And then we need to address the work that needs to be done to address these barriers simultaneously. Like, for example, if we're hearing that state departments are lacking resources to run public programs, we need to ask ourselves why. Like, what are some equitable ways to increase revenue for state departments? What are the barriers with our tax codes that need to be addressed, so on and so forth. So we just, instead of saying like we're facing an obstacle, let's push these things into the private market, we need to ask ourselves why we're facing the obstacle and address them simultaneously. I think another key takeaway is in the interim, while state departments are struggling to administer these programs, that organizations really need to be funded to do implementation work. The reality is that our state departments are relying on our organizations to support their efforts to stand up these programs. And what organizations like mine are seeing time and time again is that we have a ton of investment in our campaign and getting a win. And then once the win is secured, there's no investment in follow through. We're not seeing these wins through the end, and to see it through the end means implementing them and making sure the law is passed as it was intended. And I would say that there just needs to be like a real investment in a cultural and narrative shift around financing public good and caregiving policies. I'm sure we all know, like, I think we are losing ground on a lot of important fronts on these issues because there's just a lack of will and education around investing in policies, especially ones that are seen as women's issues. There's a lot of public skepticism about allowing like states and local governments to administer these types of benefits. But I think that we just like need to do some serious public education on the systematic defunding of our public goods and how we need to reinvest in them. And I think just two other things about Colorado specifically. We have TABOR, the Taxpayer Bill of Rights. It really, it creates just a huge barrier to get anything done in the state, any public good, any like increase in revenue. It's almost impossible. So that's just an example of something. If we want to stand up other like caregiving policies in Colorado, we have to be like addressing TABOR simultaneously to be able to do that well. And I just think one really interesting takeaway that I thought was pretty innovative in Colorado to deal with one of the financing issues that we were having is, you know, premiums aren't going to start being collected until next year. Funding needed to be collected to start the program because of our, again, like our tax system and just the way that our state budget works. It's virtually impossible to get any money from our general fund to start these types of programs. So when we needed the money and weren't sure where to go for it, what the Department of Labor decided to do was to charge the state as an employer their premiums in advance. And to start the program, and then once premiums are collected and benefits are administered, the state as an employer will have a credit that they kind of already paid their premiums and they'll be able to work that down. So it really was just, we were able to keep the entire financing of this like public within the state. We thought about like, could we get some private financing options to start the program? But again, we're very committed to pushing the narrative as much as possible. We need to invest in our public goods. So I can stop there.
That was fantastic.
Thank you. Yeah, agreed. Thank you, Ashley. It was a lot of really rich stuff in a very short amount of time. So I really appreciate you sharing those reflections and those, just the walkthrough of the program. I'm sure we're all sitting on a bunch of questions, but I'm gonna open it up to you guys and just see where people want to jump in. Questions for Ashley, questions that come out of the previous session, or just what's on your mind as you kind of absorb and digest all of this. I see Mark has a hand. Go ahead, Mark.
So Ashley, I understood that you said you made a choice not to push it through the legislature, to put it on a ballot initiative, which is very interesting because something very similar happened in the state of Maine on a long-term care financing system, and it failed miserably on the ballot initiative for a host of reasons. What made you particularly confident that that this was going to work on a ballot initiative? Because you have very targeted opposition. So I'm curious. And what was the nature of that opposition?
Yeah, so a few things, the first thing is we had pretty good polling. So that really upped our confidence on, the support for paid leave in the state. And honestly, we have been running a paid leave coalition in Colorado for more than a decade. Like Family Values at Work has been by our side every step of the way. We have one of the biggest paid leave coalitions, I would say, in the country in Colorado. So when folks and our coalition just has such a broad reach, like with members throughout the state who have all been watching this, like almost like a Super Bowl, like watching the legislature every year. Is it going to pass this year? Is it, because we introduced it more like 6 or 7 times, is paid leave going to pass this year? So when we, it was just a pretty easy transition to take our base and say, it's not getting done through the legislature. We have to get this done through the ballot, because we have been sitting here waiting for this. And the only people who seem to be opposed to this are these like corporate lobbyists in their little bubble in the Capitol.
Okay, that's interesting, because on the polling, the same thing in Maine, they were at 65% and they went running. But you said something really important, I think, is a lesson, which is you had an established coalition of people who worked together, trusted each other, and that makes all the difference. You did not have that in Maine, so that's great. Thank you.
Yeah, go ahead, September. And then
Just a follow on, Ashley, thanks so much for the inspiring model. I'm just curious, some of our experiences we're thinking about like making these transformative changes, is there not like just a ballot measure, right? Like, I'm just curious, a couple, maybe a 3-part question, but one is, how many years of organizing your coalition for paid medical and family leave and 6 runs that the legislature like put a time window on? Was it 2 months, 2 years, 6 years of kind of building that strong base before you went to the ballot? That's question 1. Question 2, what percentage passage rate did you find? And are there any lessons from running a statewide campaign with to this narrative change concept? Did you learn through going to your Colorado voters? Like, are there key messages that really broke through for you? And then I'm just curious, I'm being super greedy with your time as you talk about implementation being key, right? Like, because we have this joke in policy, like implementation eats policy for breakfast, because we give them the best idea in the world. If we screw it up, we lose ground. So I'm just wondering if your coalition sort of that through line, how many years to get to the ballot to pass? And is your coalition like working on implementation in some ways?
Yes, sorry, I'm trying to backtrack to the first question because I had a sequence that I wanted to
How long were you working on this before you went to the ballot? Like, how long was your coalition in place?
The coalition, a formal paid family and medical leave coalition in Colorado started in 2014. There was a more informal group of people contemplating paid sick days and paid family and medical leave. Even before that, there was like a paid sick time ballot that actually failed in the city of Denver in 2010 or 2011. And that's kind of like a lot of where the paid family and medical leave coalition was born out of, the paid sick days advocates. So, but yeah, at least like formally family coalition 2014.
And I'm sorry, the year you passed and your percentage support rate?
So the year that we passed at the ballot was 2020, and we passed with 57%, and that was under our polling, which, you know, and we did consistent polling up until like the week of the election, and it was about 63%. We did expect it to not actually like hit 63% at the polls, but it was 57%. And we are 9 to 5 is leading the implementation coalition alongside the Colorado Fiscal Institute, with a lot of support from A Better Balance in Colorado, and they are working really closely with the State Department. And actually, and just another example to highlight the importance of investing in organizations to do the implementation work, just a couple of months ago, the Department of Labor themselves reconsidered privatizing the administration of the benefits. And it was because of the mobilization of the coalition to push back that they let go of that idea.
Great, Sade, go ahead.
I think you just answered some of the questions, Ashley. I wanted to also highlight, one, Colorado is a rock star, but also is a part of the 9 to 5 chapters and one of the founding partners with Family Values at Work. So the energy and the lessons learning also started 20 years ago. And when we talk about long-term movement building and lessons learned, and even looking at wanting to push policies right now, there were 20 years of work and thinking that went into how do we coordinate paid leave in the states. And then from 2014, also thinking and strategizing in Colorado, which took multiple years of yearly general operating fund investments to really be able to move and win over time and to strategize and build that base. Ashley, and then to the point of implementation, where we see our laws from California going down, we can either improve them each year through strong implementation and get to better definitions around family. We try to think about, you know, some key tiers of accessibility and affordability and how we can continue to improve those laws. And I wonder, Ashley, if you have lessons learned on how you've been able to like either move these laws forward or improve them over time, or even having to defend them. So being able to have that organizing capacity still on this point for implementation.
Yeah, I think the biggest thing for us is we just feel like committed to sticking to our promises. Our members said, we need paid leave. This is our #1 issue. And we said, we're going to deliver it to you. And that doesn't stop at the win. And we could today walk away. We're not getting that much funding to work on implementation, right? Like Family Values at Work is, supporting us every step of the way since day one continuously, but that can't be said for every person in this work. People really do stop at the win. So we could walk away from implementation and it would have no impact on our organization, except for the fact that we wouldn't deliver the benefits the way we told our members we would. So we're here for that until it happens.
Amazing. Fondation Chanel, go ahead, whoever among you has a question.
Yeah, I have a potentially very naive question for you, Ashley, and anybody else who wants to chime in, which is, can you describe the opposition in a little bit more detail? And it's probably multiple different groups. Like, who is it? What are the arguments? What are some of the key arguments or narratives that oppositions are using and really getting traction with? Yeah.
Yes, and that also jogged my memory of something else September asked. So the opposition traditionally through many years of trying to pass this at the legislature is like the Chamber of Commerce, NFIB, those are like some key opposition players who show up. We have like some like city, so like local lobbyists like CML at the local level. And, they are able to shape a narrative that they have so many more people on their side than they actually do, who think that, and that is a huge thing. In the legislature, our opposition was small but mighty. They were able to really act as if like the entire state of Colorado thinks that this program would be absolutely detrimental when they weren't really representing the definitely not the workers, and not even the small businesses in the state. Like there's a ton of small business support. The businesses who actually like can't provide these benefits out of pocket, there's a ton of support from them for a program like this. And there was just a really coordinated effort in the legislature, which also really hurt our efforts there, where the opposition, it was the most lobbied against bill in 2019, the paid family and medical leave bill. The average bill in the state of Colorado maybe has 50 lobbyists on it in a year on average. Paid family and medical leave had about 180, and the vast majority of them were in opposition. So people, like every big corporation, was just throwing money at opposing this through the legislature. And the interesting thing was that the minute we shifted to the ballot strategy, it was night and day, no opposition to be found, truly. I mean, they didn't want to be the public face of, these were behind closed doors conversation in the Dome. Once it became a public fight, they didn't want to be the face of saying like, we don't support families and babies. So they really backed off. They saw the writing on the wall that this is popular in Colorado, and they weren't willing to put their social capital on the line.
In DC, on DC paid leave, we saw oppositions from hotel consortiums or the hospital consortiums, also the university consortiums, because of their either offering or other, as we were going after like an employer-based taxation model, really trying to figure out how to message. But where we were able to really drive up support were from small businesses to offset some of those, and really being able to build out the base and engaging, which also helped in 9 to 5. And that goes back to their long-term base building for so long with the various stakeholders. And I think what we have learned over time in these fights are who those oppositions are going to be and how to build up the counter arguments. We know that there's going to be large businesses. We know that there are going to be folks who are on a different side of the political spectrum than we are. But we also know opposition can come from our own advocacy groups that we work in coalition with when we're struggling over different bottom lines, and if we're just willing to win a bill, and if we're willing to win a good bill. And really being able to work deeply in coalition, which I think, Ashley, you have lots of, they built power to really stand strong on their base bottom lines around the coalitions within our advocacy groups and within other national groups that were willing to waver when we just weren't.
Yeah, thank you, Sade. Yeah, that just did remind me, you know, the Colorado ski lobby is very powerful. Colorado, big industry there, and they were a huge opponent, and we did have to make a concession so that they wouldn't, you know, oppose in full force. And that concession was to move currently, and this is something we do want to go back and fight for in the future, job protection for the benefit doesn't kick in for 180 days because basically everyone in the ski industry is a seasonal worker. So their terms end in 6 months. So they don't want to protect the jobs of these seasonal workers. So we're trying to get that, narrow that window a little more, less than 180 days before you can have your job protected if you take some leave. But that was a big concession. And another thing I'll say is, you know, there was some internal strife with when the governor of Colorado is the one who posed the private model. So when you have somebody in that level of power, you have a lot of people in a 100+ organization coalition who are going to have differences of opinion of how to move forward. And it took a huge monumental effort on 9 to 5's part and the steering committee and Family Values at Work and other national partners to hold the line on the fact that this has to be a social insurance model. And that is really something to consider, that like when your coalition isn't aligned, you have to do everything in your power to stay aligned, because that is where your power is coming from.
Sorry, you did pronounce your name and I've already forgotten how to pronounce it. Filene?
Oh, it's Feline. It's okay.
I knew I had the wrong.
No worries,
Please
Pooja.
go ahead.
So this may be a little bit ignorant as well, but you know, once you took it out of the legislative process and you went to the ballot, how did your message evolve and how did your coalition stay engaged with that shift?
So so the other thing is that I cannot tell you what would have happened if we did not run this in 2020 during like a pandemic year. This had a huge impact on the ballot as well. So who knows? But a big thing, we were really getting like a lot of contradictory feedback. There were, because of the pandemic, on the one hand, people said, we understand more than ever why we need paid leave. And at the same time, we're seeing like our small business, our local businesses, like be battered by the economy right now, and we don't want to burden them anymore. So it was a pretty simple message, but our message was essentially something along the lines of everybody needs paid leave and this model is good for businesses. That works. To really like there's so much misinformation. And that was one of our fatal flaws in the legislative process. We didn't get ahead of the misinformation about how this program works. So our opposition was able to plant a seed that was truly just false, just like saying things like, businesses will pay $500,000 a year for these benefits. They'll have to pay every of their employees' benefits like out of pocket. It's going to go insolvent. We're going to go bankrupt. I mean, these just false narratives really took hold. So with that lesson, once it got to the ballot, we were really able to stay on top of that messaging, I would say. And, so much of our messaging from the legislature to the ballot, and, I was the co-chair of the legislative initiative and the ballot initiative. And part of that, the strategy was to keep the faces the same. So I could go to everyone and say, it's the same coalition, it's the same exact policy, it's the same issue, it's just a different outlet to get it done. And that worked a lot. It worked well. And people really did have a lot of loyalty to the coalition. So I did get a lot of people reaching out to me saying like, what is this ballot? Are you behind this? Is this okay? Should we support it? So just keeping the continuity was also really key.
I might take privilege of asking a question too. I mean, what's sort of being talked about a lot explicitly, but also kind of beneath everything is this idea around building the public will and building the public support for care as a public good. And I'm curious just to hear from Ashley or really anyone on the call, both around like messages that are about that, the public good piece, and also the tactics, like how does one create sort of that surround sound of generating that does generate the public will?
I would love to hear other people's thoughts, but I'll just say, I would really be remiss if I did not mention Good Business Colorado, an organization in Colorado. These types of policies, if you break them down in layman's terms and explain your social insurance and explain the benefits people are getting, 99% of workers are like, this is a good idea. Like, I like this. I want this. Your obstacles are coming from the perceived business opposition, the perceived, how is this going to impact business? This is hurting more than helping. And Good Business Colorado co-chaired the legislative initiative alongside 9 to 5. And they did an extraordinary job with organizing small businesses. And I will say that is something that we have that I'm hearing a lot of other states don't, that I think is so key to our success. We had the ability to kind of neutralize this is bad for business narrative because of how robust our small business organizing was.
I think changing public will also comes from deep organizing and having trusted messengers within communities, and 9 to 5 Colorado did that and was really, as they continue to implement work, thinking about, do we have the right partners? Are we reaching the communities that are going to benefit this from the most? And doing one-on-one education. The investment to have know your rights education, one-on-one education, have enough organizers on the ground to meet those most impacted was critical to building up and changing that overall messaging. Because once we relate to people and talk about tell us your story on how this is going to impact you and here's a solution, we can draw the connections and the public will. And then we can focus on the big narrative change as well when we're talking about media, when we're talking about how this is a public good. It's something like $57 billion we lose around childcare in work productivity. what does that impact look on society? And so if we can really flip the narrative to talk about the holistic impact of what it would look like to be a gating economy, especially as we go into a recession, is really how we shift it. So both through strong organizing and having the ability to reach those communities and individual flips on public will, and then getting that to employers as a second thing of like, this is the overall holistic benefit, and then changing our narrative on the big pictures on like, this is what the economic impact looks like, but not being weird and wonky about it. Just like, this is the dollar amount on how it's hitting our purses right now and what you could have available. Before the pandemic, people just did not understand that they even had a right to paid leave. And that shift in the narrative and being able to shift that in Colorado was instrumental.
That's so huge, Sade. Like, I cannot tell you, I've talked to thousands of people about paid leave, like thousands. And women of color especially, we like carry the world on our shoulders like it's just another Tuesday. And when you say to people, you know, you deserve more, like it takes a minute for that to click. When you say, you know what, I had a child and then went back to work 2 weeks later, and now I'm raising a family of 4 by myself and making $7 an hour. It is what it is. We have to say like that should not be. Like, we deserve more and we should be demanding more. I think that's a huge part of narrative shift as well.
That's a great note to end on.
Amen.
So much. I really just appreciate Ashley and Sade and Mark for all your comments in this really great group discussion. I think we'll all get booted out to the big room in a moment, but thanks again.
Thank you all.
Thanks very much. That was just great. Learned a lot.
Hi, this is Paul Nebenzahl. I'm the executive director of Mayor Rothschild Foundation in Chicago, which is a stepchild of the Hulda B. and Maurice L. Rothschild Foundation, longtime participant in creating a better world for older adults. And I can't see who to pass it to because it's so bright out here. So someone please take the baton from me.
Yes, I think the only person left is Priya.
Hi, everyone. I'm Priya Pandey, she, her pronouns. I'm a policy analyst at the Center for Law and Social Policy.
Well, thank you, everyone. What we're going to do is start off, we will have Andrea Peluso share a little bit about some of her work, and then we're going to open it up for discussion. So think about the questions that came up during the first panel, the questions that come up as Andrea speaks, and really questions that you've been wrestling with in your own work. Go ahead, Andrea.
All right, so I came prepared today, sort of invited to speak about a local preschool for all measure that we were a part of passing. So I'm going to give some background and context on that. But I also want to bring into the space, and I asked if it was okay, like leading up to this from the past conversation, we also did pass and led the campaign to win a universal paid family and medical leave program in Oregon that's being stood up and implemented now as a different funding structure. So I can speak a little bit to both of those things if that's helpful. And then happy to talk also about work that we do on the ground in Oregon to build toward a universal childcare system and some of the kind of revenue conversations that we're having currently. But I'll start with the preschool, which is part of, for us, that's part of the bigger childcare conversation. So when we organize moms and caregivers on the ground in Oregon, we're a grassroots organization that's really doing that kind of organizing to build campaigns. And we really operate in our work from centering and really working on with our member leaders a race, class, and gender equity lens in the work that we do, and kind of start all of our work from that place. When we think about building a childcare system, a universal childcare system, which is our demand, we're thinking really about care for kids 0 to 13 plus for some kids who are going to need care beyond that age. And that includes a number of different types of programs for kids at different ages. So for us, paid family leave is lots of things, but one of the things that it also is part of a childcare system, because what parents of newborns need is time at home. That's the childcare that's most needed. And then, as you go up kind of as you grow up, you need different things. So, in a preschool age, kind of for preschool age children, we need more kind of formalized preschool programs, plus kind of the wraparound care supports and services that families need to be able to participate in those programs. So, we know, and we are in the process now, somewhat confidentially on this recording, of like trying to figure out what the universal system that includes these really age appropriate and mixed delivery, many different provider types, like what does that childcare system cost? You know, what kinds of revenue do we need to raise to be able to implement that kind of a system? And to be honest, it's going to be really hard for a lot of our states to do that aren't like high wealth states on their own without federal investment too, which is why this sort of missed opportunity around a really transformational investment at the federal level is so disappointing. So we know that to get to that system, we're going to need to raise revenue sort of at every place we possibly can. So an opportunity arose because of political interest by County Commission champion Jessica Vega Peterson in Multnomah County, which is the county that Portland, Oregon is in, to advance a universal preschool measure and raise local revenue to support that. So for us, that's, you know, part of the larger pie. You know, we're going to need to look at how we raise revenue at the county level, at the state level, at the federal level to fund this system, and sort of which parts are funded which ways. So we worked on that very heavily from the very beginning. And I wanted to describe a little bit about that process, which I think was really great. It started with parent advisory bodies. So the county commissioner worked with a local group to recruit parents of color from a variety of different supported culturally specific organizations to participate in envisioning what the preschool system would be that they would want. And then developing a set of kind of research and analysis about existing preschool structures in other places to kind of help to inform what's working, what's not, what's getting the outcomes that we want to get. Then it evolved into having a task force that involved a variety of different stakeholders, from parents, early learning advocates, school districts, higher education, folks who might support providers in getting more credentials, housing, you know, advocates, healthcare advocates, a variety of different organizational partners and parents and providers to participate in really digging in on like what the policy decisions would be that would inform that program. And I'll share in the chat some links to some reports and things that go into more of those kind of policy decisions, if that's helpful. And then we moved into, and that met for a while. I think we met for maybe 18 months. I participated in that task force. It had multiple work groups. Then we moved into a pre-referral steering committee, which was really where it moved more from a policy conversation to a campaign, because it was something that the county commissioners ultimately referred to voters, which is what was required to raise that kind of revenue. And then there was a ballot measure campaign to pass that, which happened in 2020. So there was like, you know, canvassing happening in the context of COVID, and you know, we did what we could do to kind of you know, move that forward. It did pass. It's funded by a personal income tax, so on high income earners. So there's a 1.5% tax on taxable income for individuals earning over 125,000 or joint filers earning over 200,000. And then if you earn over 250 as an individual or over 400 as a joint, as a couple, as a joint filer, then there's an additional 1.5% tax. So those folks are paying a 3% instead of a 1.5%. And we're in implementation of that. So it's, you know, the intention is for it to be universal, for it to apply to all children, but there's a kind of targeted universal approach to implementation where the slots that are coming online, because this is for folks who work in childcare, you know, like there is a shortage in sort of every part of this system. So it's not like just adding money fixes the problem, because we need time to build the facilities, to build the workforce, to, you know, grow the capacity of the system to serve more kids. And that's just not something that can happen overnight. So their plan is to be implementing this over a 10-year period. And every year they're, you know, adding more to the workforce, adding more facilities, growing the number of children who are being served. So the first intention for kids being served is to really focus on recruitment of kids to the program who are being served by culturally specific programs, who are kids of color, who are migrant and refugee children, children who speak languages other than English, children with developmental delays and disabilities, and a kind of a set of other focus areas. So I'm happy to say more about that if it's helpful. Briefly, I'll also say that we did win statewide paid family and medical leave program that is structured as a social insurance program in Oregon. And the contributions are capped at a total of 1% of payroll. So it comes through a payroll tax. It's paid 60% by workers and 40% by employers. which was an unfortunate compromise. My personal opinion, I think it should probably 100% be paid by employers, but this was what it took to get it done. So it is structured that way. The resources are collected by our Department of Revenue. They're allocated to our employment department that administers this program. It is universal. It applies to every person except for federal employees who are not allowed to require inclusion of, but every other worker is included in this program. For self-employed folks, we have an opt-in. So self-employed folks can opt into the program, but there's not like a mechanism really to require it otherwise. So we have a program that's universal. We built in a number of kind of progressive ways of approaching that policy. So, we have 100% wage replacement in Oregon, which I think is the only state that has that currently for our lowest wage employees, so they can participate. And we have a cap that we think is pretty progressive. So at some point, higher wage employees are capped on the amount of benefit that they receive. But it's still, replacing more income for low income folks. So I'm happy to say more about that structure if that's helpful too. And I'll just pause there, I guess, if there are questions or kind of broad questions. I think I'm just here to kind of respond in an Oregon context if that's helpful, but also for y'all to just chat about, the topics you want to chat about.
Yeah, so we're going to start. We also have SJ who is on the panel. So I'm going to start by just opening up, see if anyone has any pressing questions or reactions that they wanted to share.
Allison, it's Scott. If no one else is jumping in, I'll jump in. And my question is to Andrea. Andrea, thank you very much for describing your experience in Oregon. Was there ever any conversation about joining it with some sort of care fund for older adults, or did that just not come up?
Yeah, I have to admit that on a local level, I struggle a little bit with the kind of more universal funding approach, just because each of these categories of care is different and they're administered really differently and they need sort of different structural inputs, but also because they're very expensive. And so talking about like a single revenue source that's going to raise enough to have an impact across multiple systems feels really hard. And I think one of the things we were part of a tax ballot measure a couple of years ago that was raising our corporate income tax, which is pretty low in Oregon. And it was raising it in this way that was like generally about funding a number of programs. And I think what we learned from that was like voters, we've done a lot over the years, right, of raising too little money with too big of promises. And so people are like, we already raised money to fund education. We'd have all of these different sources of revenue. Why do you keep coming back and asking us for more? And it's because we're frequently under asking for what it is that we actually want and what we know will make an impact more universally. And so then what voters interpret that to mean is that we're like wasting the money, like that there's some kind of, we're not using it well or something. So, I think we came out of that in Oregon and our Oregon-based coalition feeling like it would be better for us to focus revenue measures on a particular solution and actually have people feel that solution to scale in their own lives than to try to spread a limited amount of resources across a lot of programs and have no one really feel that impact fully, right? So that's a place where I sometimes think about like, we want to have a universal paid family and medical leave program. That takes a 1% payroll tax by itself, to implement and fund that. We're talking about in childcare, a multi-billion-dollar system that we need to build and invest in, right? And we have various weird tax policies, as everyone does, and like, compression levels at the county level of what we're allowed to raise. And so it's just, each of the mechanisms, I think, if tied to a particular and targeted investment, maybe can feel like it's really getting to scale, but trying to spread that across a variety of things is challenging to have it feel like it's really reaching anyone. So, probably the local context matters, and what you're allowed to tax matters a lot too.
SJ, I'm curious if you have any thoughts about at what level does that multi-sector care sector approach really work?
Yeah, and I mean, I think it's such an interesting question because there are, obviously, I work in federal government. I have a tendency to be biased towards federal interventions and policies, but I think there's two reasons why, like, well, you can sort of argue why there are benefits in either direction, right? Like the more local you make something, whether it's at the city or county level or at the state level, the more tailored it can be to the particular needs of those communities, which is both a blessing and a curse, right? But I also have concerns around, because there are efficiencies of scale, right? And so we would not want to end up with a system that was a total patchwork, right? I think we can see this, we see this with the unemployment insurance program, for example, which is like 53 different systems that all sort of operate differently and have different benefit levels and have different eligibility requirements. And it's really complicated. And then where you live ends up determining your level of access to benefits. So there's sort of that piece of it, which I think, it is worth considering. But the cost piece is also, as Andrea mentioned, right? Like when you start bundling these things together, then the contributions increase, right? You need more money to pay for more things, obviously. And I think that then there are political calculations that come into effect about, how much can you realistically get done under those circumstances, right? And you don't want to end up in the situation that Andrea was just talking about, where people feel like they're being promised more than what you can actually deliver at the tax rate that you're actually able, to get past. And so I think that it's challenging for me to think about a truly universal system on a smaller scale, because you don't have some of those same efficiencies that you get when you have a much larger pool, and when you can save on administrative costs through just having like a larger, more efficient system as well. So I think it's hard to say though, right? Because sometimes you would have more will to actually get something done when you are talking about, the state or local level, where you might have a more like politically accepting environment for the passage of these types of programs. So I think there's sort of a balancing act that has to happen. I don't know. I mean, it's really hard. I wish we had good answers for these things.
And I'll say too, SJ, I totally appreciate that. I mean, one thing I think maybe Scott was in your question is, I do think it's been a struggle we could go into maybe at another workshop about just getting the paid family leave program implemented and just building a new program, and actually also just in the context of COVID and all the crisis our state governments have been in to try to distribute aid generally. And like, they're just not built to do universal programming, and we need to change that. Like, we need to change the structures within state government. So the more we're piloting and building these universal approaches to programs, the more we're forcing that transition so that we're better prepared. I mean, because, not only are we offering hopefully better services and better policies, but we're better prepared for emergencies too, because we have not been. But we do have an ambition, sort of, once the paid family leave program is stood up and functioning and working and paying people benefits, which is September of 2023, then to try to talk about, when it's politically possible to do that, adding a long-term care insurance mechanism, which other states have done. So figuring out how to add the capacity to look at, other long-term care supports, financial supports for families, and that, may be the right mechanism to do that. So there's ways I think we can take what we've built and grow it, and we have the kind of long-term ambition to do that. But the other thing I wanted to say, SJ, to your point, is like, we don't want to be raising this revenue at the local level and doing a patchwork county by county. We really want like a robust federal investment in all of our states being able to build universal and comprehensive care systems. Like, that is the ideal, because some things may be possible in some states or in some very local, like in some counties, that really is not equitable across the country and not serving the majority of families. But also, I just want to say, like, Multnomah County, where Portland is the rich. Oregon is not a rich state. Like, we're surrounded by California and Washington, but we are not a rich state. And Multnomah County, where Portland is the richest county in our state. And we were part of an effort to look at developing the exact same universal pre-K, which again is just serving part of the day, part of the year for just 3 and 4 year olds. Like, that is not a universal childcare system, right? In the second richest county, the neighboring county to Portland. And they could not raise with the same tax mechanism on high income earners enough to make that program universal for all 3 and 4 year olds with just the revenue they could raise from that county. So like already we're in a financing crisis. When we move like to the second richest county in our state, we can't finance the same program without looking at additional tax mechanisms beyond the personal income tax. So we need state investment and we need federal investment to really get to scale on these things.
Thank you. Anyone else? Roxanne?
Hi, everybody, but Andrea and SJ, I feel like I haven't seen you in forever. So Andrea, it was very interesting, these 2 different stories that you shared. And so I'm just curious, like as you were doing public education and activist recruitment and leadership development in the 2 different campaigns, was there any difference in reaction to the 2 different financing mechanisms? Like, was one easier to organize around or educate about than the other? Just any reflections about the differences there?
It's a great question. They moved through policymaking in 2 really different ways. So the paid family leave program was passed by the legislature. We did develop a ballot measure concept, like a statewide ballot measure concept for paid family leave that was more progressive a program than what the legislature passed. And in that mechanism, we did include that it was 100% employer paid, the mechanism that would have gone to voters. Because when you poll voters about taxes, they're more likely to support a tax that they are unlikely to pay. And so the tax on employers, I think, is generally probably a more progressive approach overall, but is also easier to win at the ballot. But when the legislature passed it, they passed it in the way that they did, right? The preschool measure was a ballot measure. Ballot measure campaigns are usually, we develop a policy priority, we develop sort of options for how we can pay for it. And then because this was developed and then to be passed sort of within a year, you don't really have time to organize folks around something they don't already support. So what often drives the decision about how you're paying for it is what voters will support. So, that's often how, revenue raising ballot measures work. It's not like what's the ideal structure, but what is the structure we can win. And so there was a lot of polling that went on with voters in Multnomah County to say, like, if we structure a tax in this way or that way, if it's a property tax or it's structured as an income tax or it's structured at this income level, that income level, what are you more likely to support? Then you kind of land on the sweet spot that is like, what gets a level of majority support that you can win. And the reality is that I think there's a lot of appetite in this country for taxing wealthier people and corporations at this point. Like, voters understand that a lot of people who have a lot of wealth in this country are not paying their fair share. And that there are a lot of corporations who are like hiding profits in different ways, so we had to pivot in Oregon to a consumer activities tax over a tax on profits because it's a lot harder to figure out what those profits actually are. So there's a lot of distrust of, I think, global corporations and very rich people, and a feeling that like they're not paying their fair share. And so it's just a lot more politically popular to figure out tax mechanisms that focus there.
Yeah, that makes me think about some of what SJ was saying earlier about balancing. Of course, we have our ideals, and in an ideal world, everyone would have access to all of the services they need, but balancing that with the political realities, what Mark said earlier about himself, not Mark Harris, Mark Cohen, said earlier about himself being a flaming pragmatist, which made me laugh a little bit. But it's interesting to see how these different approaches to getting a law passed can really impact some of the structure of the financing. I'm gonna see the Mark, Andrea, Priya, did you have any questions or reactions?
No questions from me, but just to plug that I'm a big fan of ballot initiatives. So this is really awesome to hear about.
Yeah, and I mean, that ballot measure for preschool did very well. And there are other counties that are trying to think about how they take a more universal approach to childcare. Like, I think there's a lot of voter support for this stuff, and more so through COVID and post-COVID. You know, I think there's a just much greater understanding of these care programs as public goods that people needed during this crisis and didn't have access to. So I feel like there is sort of a shift toward more kind of shared ownership of the need for this. I think before in polling, we kind of saw like the people who are most impacted by it supported it, and the people who are less impacted by it didn't support it, right? And now I think there's just a lot more broad support, because I think probably more folks are feeling or seeing that they are personally impacted, sort of whether they see it as direct or not. So that's good news.
Andrea, Mark, anything? No? Okay, I have some questions, and then I also want to give SJ and Andrea Peluso an opportunity to ask each other questions if they want to. One of my questions for Andrea, you said that it's the universal pre-K, if my notes are correct here, it started off by talking to parents, and then it grew from there. I'm curious to hear a little bit more about what stakeholders you needed to bring to the table in order to actually get it passed.
It's a really great question. So I just want to say I tried to invite our county commissioner, Jessica Vega Peterson, to be here today, and she sends her apologies because she's out of town and not where she has access to any Wi-Fi, or she would be here now, because she's like the driving force behind this and so proud of it. And she was really the like good political thinker who I think built the table. So I'll say from my vantage point as one of the stakeholders that participated in the process, but not like the architect behind that, I think that they really implemented a process that was very like rooted in equity. It was mothers of color who were like originating the vision for what it is that they wanted from the beginning. And then there was this parent advisory council that continued to meet. That was a larger set of parents, but there were a number of kind of representatives of that body who participated on the task force. And the meetings were even structured in a way where like the parents spoke first, like when they were asking questions about what decisions needed to be made. That was how those meetings were structured, and in multiple languages and with all the supports and all of that. So it was really great. But then on the political side, I would say too, it felt like there was a lot of intention around involving a number of different stakeholders who would both bring different perspectives. Like we were sort of recruited because we do a lot of workplace policy as like advocates for workers, to participate. We organize some, childcare providers, but also parents as workers. So, but there were a lot of different folks who were different types of childcare providers, school districts, like people who would be sort of implementing this program to help to inform what it would look like. And then there was also intentional outreach to folks in the business community and some specific community leaders, both because I think they had interest in it, but also because there was an effort to get to alignment around what the proposal would be that would go to the ballot. Because, you can win if you're polling. If you're testing a concept that's polling at like 60-65% support, which is, I don't remember where they started, but let's say it's there. You can win that without a multi-million dollar campaign if you don't have significant opposition. But if you have significant opposition, you have to run a much more robust and much more expensive campaign to overcome that. And so I do think there was a lot of intentional outreach and sort of partnership and discussion to bring along sets of partners who might have otherwise opposed the effort, which helped to, I think, streamline the process and make the overall campaign both more successful and less expensive. I do want to say too, though, there was a dynamic here where a group that was organized by the Democratic Socialists of America sort of developed a counter proposal that was bigger, like it was more expansive. With a higher tax rate and implementing things more quickly. There were some questions about whether it all penciled, but they were collecting signatures at the same time. So there ended up being this other effort that I think people who might have opposed the county-led effort didn't in the end, maybe because there was this other thing in play. And eventually what happened was there was a series of negotiations to sort of combine those and have just one referral by the county commission. But there was that other kind of political dynamic going on too.
Interesting. there's something that some people considered worse, so they said this was a better option.
It was a much higher tax. It was a much higher tax.
Scott, go ahead. I see you have your hand raised.
Just to make a parenthetical comment that it's so interesting to hear Andrea talk about this, because many of the arguments, you could just take out the word childcare and put in older adults. It's really interesting.
It is, yeah, and it's a very similar process, right? Like there should be a stakeholder process that develops a kind of ideal policy proposal. And then when you're going to run something on a ballot measure, you need to know that you can win. Like you need to test it, you need to poll it, both the program side and the revenue raising side, and make sure that those things match. And the challenge is they sometimes don't, right? That's why we end up with raising less than we need to implement the full program, because we can't actually get public like support at the level that we need to for raising the amount that we need to raise to do the thing that we need to do. So then we have to compromise on the program side. So it's a different process, a little bit different process around a ballot measure. I mean, I will say, like, we see ourselves, my organization and our partners that we partner with are all economic justice organizations that do organizing and movement building work. So I do think that there is, with time and investment in organizing, you can shift the landscape to make more possible. So we can shift opinions and build support. And I think we have been engaged with many people across the country, including many of you, to build support for care structures, and a different kind of public good conversation about that. That's really been shifting our landscape and making more possible. And we should be investing in that long-term movement building work, because that is what is creating these opportunities when they arise that we can kind of capture and run with. And when you're doing a short-term ballot measure campaign, like, you have to run with the thing you can win. And so like that might be more narrow than the thing you'd build toward if you had years to do it.
Just as an FYI, I believe we have about 3 minutes left. So go ahead, SJ.
Well, I don't want to stop at you and if you had a final question, but that just prompted something for me. Based on what Scott and Andrea just said, I'm curious for everybody who's on the call, what your thoughts are on how to really build this case and how to best communicate to folks in this moment, which I agree is really ripe coming out of the last 2 years, to be really making a strong case that these are public goods. Because I think for such a long time, right, childcare was very much understood as the responsibility of individual families. People were less likely to say, like, well, you would hear all the time, right? Don't have kids if you can't afford them. People are less likely to say, don't get old if you can't afford to care for yourself. But there is still this piece that's like, well, you've had a lifetime to save. Why do you now need help, right? Even though we all know all the reasons. So just from a purely comms standpoint, I'm curious if people have thoughts about how we can best utilize the moment we're in and the disruptions that we've seen over the last 2 years to be building that case that all the broad range of care from babies to older adults, how that is a public good that we should be making public investments in.
I would say care economy, that it can accommodate all. It can accommodate both the giving of care, it freeing up workers so that they can stay engaged in their jobs, either if it's to care for younger children or older adults, direct care workforce jobs, just the importance of those in just that it can accommodate many different constituencies.
I will add, I think that some of the national work that's been done using that frame of the care economy and bringing in all of those different stakeholders has also been, even though we didn't pass the transformative investment that we wanted to, it has transformed some of the language that we use and has prevented some of the stakeholders that were previously pitted against each other from splintering in that way. Often we hear on the long-term care side, which is where my background is, you hear, oh, if I'm a consumer,